When I was 19 years old, I delivered my second child, and she was born with cystic fibrosis, and I had no health insurance. She was medevaced, sent over to the neonatal center, and she spent a month over there. We had a devastating summer that summer. I had no health insurance. No one came to me and said, you know, you can get the care at a community health center, you can get additional services here, you can get reduced medications, you can get the care for your child, don't worry. And I can do that here.
Well, I think if you were to ask virtually any community organization what their mission is, somewhere it would have something to do with the quality of life and quality of care. The Community Health Center is a key piece in furthering that mission, not just for our organization, but for the entire community along. I think that the Community Health Center does much in terms of preparing people to lead a meaningful life, not only from their health standpoint, but from their economic status standpoint.
The Community Health Center is a neighborhood-based clinic. Their healthcare homes are basically like any other clinic, with the exception of the fact that they receive federal funding to help support the work that they're doing and to provide services to a target population, low-income, uninsured, or underinsured people who lack access to healthcare. It's a program that is serving over 15 million people through 5,000 sites and 1,000 funded organizations across the country.
We are here not for ourselves, not for the clinic itself, but for the community and for the people that come in every day.
Regardless of their ability to pay, we will see them and take care of their needs for routine care as well as treatment.
There's a safety net for people who are under and uninsured.
Their family loses insurance, we can still see them. If they lose their job, we can still see them. So that makes a huge difference, that they don't have to change providers because they changed insurance or something like that.
A lot of people in Alaska are not aware of community health centers, and many don't even know that they have one in their community and don't realize what a valuable resource that they have.
We will save millions of dollars for our community by having people have a medical primary care home. It's not a free clinic by any means, but if you don't have the money,
they'll see that it's affordable.
The physicians that work in community health centers are board certified, so they're the same people that would be working in the hospital or would be working in a private practice clinic. Typically they choose to work in a community health center because they're mission driven, they enjoy working for a place that's really making a difference in the community.
They take real personal care in taking care of you as an individual.
Part of our mission is to have high quality health care, and we watch each other and try and have programs that are proven to prevent illness rather than just treat it after it happens.
By providing prevention and early intervention when people are experiencing health problems, they reduce emergency room use and acute hospitalizations, and that saves incredible amounts of money and reduces costs for the country as a whole.
Working with the clinic, they keep me in tune to stay ahead of problems.
Major populations that we've seen are people who for many years did not have any medical care.
Everybody agreed that a community health center could be a salvation of health care.
This facility, it's 2.5 years old, was really a community effort.
The partnerships, or we call them collaboration with our community, is what brought us into existence in the first place.
Probably was 15 to 20 local businesses that contributed, a number of different granting organizations, and so it was a widespread effort to build this building. And I think the need was here, talking to the community involvement was there, and so it all came together and worked.
We have appreciated the funders who have participated with us in our new facility and in our other programs, because they have made a lot of things possible that would otherwise not be possible.
when you have community people working on a board, they know their own community and they know their own needs.
For us, it's been very important from the very beginning of our project to have broad community involvement.
We used to operate out of a makeshift trailers and garages and converted huts and all kinds of things, and so we had a hodgepodge of buildings, and then we raised the money for this building through grants and community donations.
Yeah, we had to have community matched to get the grant, and it was over $500,000.
Right.
We did a lot of benefits and a lot of fundraising.
We worked with our partners in tribal health and tribal government. That's been an interesting model and actually really successful in terms of building on a resource that was already in place and very strong.
It is a model for other places because you got municipalities, tribes, state and federal government working together for healthcare instead of having people trying to duplicate it. And it has been fabulously successful. We have the best treatment we've ever gotten in our lives.
On the Yukon-Kuskokwim Delta, we represent 58 traditional councils who have 48 villages that they live in. Almost none of them connected by roads. We cover the size of the state of Oregon for our service population, which has about 26,000 people.
We were founded in 1972 as a rural health center with a 9-member community board. They were getting very sporadic, intermittent health care, and they wanted a health center in the community. It started out in the school, as a room in the school. It moved over into, we have a lot of World War II cabanas in Unalaska. We are 800 air miles from the nearest tertiary care facility, which is in Anchorage. And it takes 3 to 3.5 hours on a good day, if you start from our island, to get to Anchorage.
Plus, before we had this, you figure you had to drive 100 miles round trip to Wasilla to see a doctor. Or if you need a specialist, you were driving 200 miles to Anchorage. Now a lot of it can be done right here.
I would have to drive all the way to Anchorage, make the appointment weeks in advance, and hope that something didn't happen by the time I got there. It usually does.
I compared the numbers of October 2005 with the numbers of October 2006. We are up 75%. That tells me there's a lot of people in this community that we're not getting health care.
Well, we serve a population of about 6,000 through the census data, very sparsely populated.
So they come in with very complex problems.
And then a lot of our patients live out remotely, either coming into us on snow machine, occasionally dog sled and then car, sometimes boats, sometimes airplanes, a combination of ways that people get to the clinic, and obviously that has a huge impact on their ability to get access to services.
That's been a challenge because you're not sure what to address first.
A lot of the folks haven't had medical health care in 20 years. It's gratifying to me as a healthcare provider to make a difference in someone's life.
Folks, I can't urge you enough to see these health care centers in Alaska.
There needs to be a shift in this country of how we take care of people and how we provide health care in this country, and that's what we're working to do.
Central Peninsula Health Centers follows the format of community health centers across the country in that we focus on vulnerable populations, and that's folks that are under and uninsured or have other barriers to health care in our area.
So in looking at the past, there's been a lot of growth. In looking at the present, there's a lot of capacity that people need to know about and use. And then as far as the future goes, there are a number of communities in Alaska that are still lacking. We would like to see additional New Start community health centers, meaning organizations that currently don't have funding for a health center to get that. There are existing health centers that we would like to see add services or new access points. Community health centers need to partner with other community-based organizations. And everyone needs to work together because at the end of the day, the healthier a community is, the stronger the workforce, the better the ability to become educated and to educate, the better off the entire community.
Because healthcare doesn't, of course, start and stop here in the health center. It's a community affair.
The Primary Care Association has served as a resource to us of providing some financial direction.
The Alaska Primary Care Association is a membership organization. We're there to support the community health centers and to help them deliver their services in the very best way possible.
They also provide a place for us to go to talk with other directors of centers so that we can kind of support each other. And so it really is an association.
I've seen the Primary Care Association grow from 1 employee to 13, maybe 14 people. It's been very important for us because having the Primary Care Association there providing that technical assistance to other community health centers has actually eased my burden.
I think that the Alaska Primary Care Association is utterly vital for the health of our community health centers, which are then vital for the health of our population. It's the coordinating piece.
At the end of the day, it's all about improving access to care.
Our vision and our purpose is to provide 100% access and 0% health disparities, and we can only do that collectively together.
It doesn't matter what culture you come from. It doesn't matter how much money you have in your pocket. What matters that you need help and they're willing to help no matter what.
It really is a non-judgmental approach. It's take every person as they come, take them where you find them, and work with them just the way they are.
They just give us good health care. I think it's all good for everyone, not just our family, but for everyone in Cordova, the community.
It's kind of our way as natives, you know, as we try to take care of our elders and we try to maintain a good, healthy environment for our youth so that, you know, we can continue to survive.
I was a medical mess when I came here. I don't know that I'd still be alive. For whatever problems you've got, they can be an answer to your prayers.